Hello, everyone, and welcome. I'm Rebecca Schuett, Chief Development Officer of the San Francisco General Hospital Foundation. I'm delighted and excited to be with you here today to host this briefing. Our vision at the foundation is that everyone deserves access to exceptional healthcare. Our mission is to fund and support Zuckerberg San Francisco General Hospital because we believe in health equity, access, and quality healthcare for all, built on the pillars of innovation and new models of care. Today, we are so honored to have special guest, Dr. Lisa Winston, Chief of Staff, Hospital Epidemiologist, and Infectious Disease Doctor at Zuckerberg San Francisco General Hospital and Trauma Center, join us in a conversation on monkeypox. Welcome, Dr. Winston. Thank you. With officials declaring a national state of emergency over the monkeypox outbreak and a scramble for vaccines resulting in long lines here in San Francisco and in many other US cities, let's begin by separating fact from fiction and attempt to educate and better understand the risks and how the disease is spread and how to prevent transmission. So the first thing we wanted to ask you is, what do we know and not know about the virus's origins, mutations, and individual risk factors?
Yeah, great question. I may give a somewhat lengthy answer to this one. I think the answers to the next few questions may be a little bit less lengthy. But I think as many people have read, we first realized that monkeypox was a thing, that it was a virus in 1958 when it was discovered in laboratory monkeys. However, the name is really a misnomer, and the WHO has let us know that they are intending to change it. Because it really doesn't reflect accurately the likely origin of the virus. And, it may also be associated with some stigma in terms of, if people have it. So a change in the name is anticipated. It's not entirely clear what the host, the natural host for monkeypox virus is, but it likely circulates in rodents and may circulate in other animals. And the first human case was actually detected in 1970. We have known for a long time that monkeypox is endemic in Africa, meaning that, it is known to exist there, and it pops up from time to time at relatively predictable levels. And there have been two clades or strains of monkeypox that have been described. One used to be called the Congo Basin strain, and it's more severe. It has been renamed as clade 1. Again, with the WHO's, the World Health Organization's intent not to name viruses after places, because, of course, infectious diseases could, spread anywhere. And often, the place where it was first discovered doesn't mean that that is the only place that it exists or will exist. And then the other strain or clade was referred to as the West African clade. It's now known as clade 2, and it's divided into two related subclades, 2A and 2B. The clade 2 tends to cause less severe disease, and that is the origin of the monkeypox virus that is now circulating worldwide. It's thought to stem from cases that started in Nigeria, probably in about 2017. So before 2022, all the cases outside the endemic areas in Africa were either directly linked to travel to Africa or to contact with imported animals that had been imported from Africa. And we have certainly seen monkeypox in the US before, just not nearly at the same numbers that we are seeing now. So how is monkeypox being transmitted now? Well, we know that it is circulating worldwide in social networks, mostly, but not entirely, in men who have sex with men. We'll go into this later, but, important to, just point out that anyone can get monkeypox, but that is the group that is most affected currently. This is a new or newly described pattern of transmission. Although, as scientists are discovering it, it doesn't look like that it goes back probably a few years and may just not have been detected, but it may have been circulating in Africa for a longer period of time before the worldwide spread was noted. People have debated, is it, truly a sexually transmitted infection? In other words, does it require sexual contact? Is it spread in fluids that are exchanged during sexual activities? Or, is it really more about close contact? And the jury is not entirely in on that, but close contact really seems to be the primary mode of spread.
Thank you so much. That is great to know and really helpful. So you talked about a little bit about transmission. And so I guess the next question is, can you talk about the differences between how monkeypox is primarily transmitted and what, if any, are the similarities between COVID-19 and monkeypox when it comes to how viruses are spread?
Yes, lots of questions about this. And of course, we have spent the last 2.5 years in a COVID-19 pandemic learning and debating lots about how that newly described coronavirus is spread. But, they do seem to be spread in primarily in ways that are different. I will say that, in the healthcare settings, for example, in our hospital, we use very similar personal protective equipment, healthcare personnel do when they're caring for patients who have known or suspected monkeypox or known or suspected COVID out of, really an abundance of caution for both of those. But for monkeypox, the primary mode of spread really does look like it is close contact, primarily close skin to skin contact. However, there have been cases that have been described that seem to be related to inhaling virus that probably has been aerosolized, gone into the air, like, for example, from changing bed linen. That has been in contact with, somebody who has monkeypox lesions. In less common cases, it may be able to be transmitted, through a cough or a sneeze or something like that. But that actually seems to be pretty uncommon. COVID-19, on the other hand, is mostly transmitted via respiratory spread. And, we've spent a lot of time debating, how big do the droplets have to be? How far do they travel? How many, what types of masks? And, for COVID-19 spread, it spreads more readily in places that don't have as good ventilation. It certainly spreads more readily when people are close together, but they don't have to be touching each other. And then one of the big differences between COVID and monkeypox is that COVID is actually it's very infectious, and you can spread it before you have symptoms, or even if you never are going to develop symptoms, if you're completely asymptomatic. And many people with COVID, have mild symptoms that, they think are something else like allergies. And so that's one of the reasons why we have had so many cases, is that, this asymptomatic and very easy transmission. Monkeypox, on the other hand, although it's certainly, we're learning that you can certainly transmit it from person to person, it really does seem to require that close contact. And people do not seem to be infectious before they have symptoms. So monkeypox has a pretty long incubation period after you're exposed. might take as few as a few days, but up to a few weeks before developing symptoms. But you're not infectious in that period of time before you develop symptoms.
Thank you so much for that. That's great to know. So much like the arrival of HIV/AIDS, monkeypox has received the stigma or tag of being a disease that only affects gay or bisexual men. And can you speak to the validity of that as well, and which groups are most at risk of catching the virus?
Yeah. So I think that this is a really important point, because we have known for a long time that anybody can get monkeypox. In endemic cases in Africa, for example, children have been some of the groups that have most commonly been infected, which may have to do with contact with animals, but also with contact with other people who may have it. So there's nothing about anyone's biology that is going to say that you can't get monkeypox. So I think that is very important. On the other hand, we do want to acknowledge what the epidemiology is and how it's currently spreading, because if there's a particular group that's at higher risk, at least at the moment, then you want to be able to target any prevention messages, and also particularly vaccination to prevent the spread of monkeypox, to the folks who are at higher risk. So, so most of the cases are, in fact, right now in men who have sex with men, and trans people who have sex with men. But as said before, there is, we can all get it if we had an exposure. So some of the messaging, for example, some people might be wondering, I've been asked by my neighbors about this, what behavioral changes, should we be doing? Should we be, worried about monkeypox? And I mean, I think we've certainly learned a lot about behavior change from COVID from the last 2.5 years. But in terms of monkeypox, we don't really need to, any of us, we don't need to be changing our behavior with respect to who we visit or socialize with, going out and shopping, going to, entertainment venues, or anything like that. That's not, again, how this is spreading. But for people who are in the social networks where it does seem to be spreading, in addition to providing vaccine and offering and encouraging vaccine in those populations, there have been some messages from public health that have gone out about changing sexual behaviors, considering number of partners, venues, those sorts of things that people can consider to be more protected, especially as the number of cases is high.
Thank you. And sort of as a follow-up to that, we wanted to ask you, how does Zuckerberg San Francisco General Hospital's experience and leadership in HIV/AIDS and COVID-19 inform or guide the current response to monkeypox?
Yeah. So I would say that here, I have amazing colleagues, and people have really stepped up immediately to be at the forefront, of trying to respond. I think one of the best examples is our COVID vaccine group, who has, just done phenomenal work in terms of providing COVID vaccines to the community, really transformed and has been, provided the most to date monkeypox vaccine doses, in San Francisco. and has been, offering walk-in appointments so people can come in and get it, as well as appointments for people within the San Francisco Health Network. And trying to address everyone who, may be in a risk group, even if they're not patients who get care within our network, to make vaccine available to them, but also doing outreach to patients who do get care within our system, because those patients may be more vulnerable and may be less likely to hear, through social media or news reports, or be able to, access vaccine in other places. So, just a huge shout out to the leadership of our vaccine group here. And then, also, very impressively, the folks who lead our urgent care clinic on campus, as well as our HIV clinic, Ward 86, have just taken the lead in terms of seeing patients who may have suspected monkeypox, doing diagnostic testing, and also, providing treatment, which is a little more complicated now, since I think we'll talk about treatment in a minute, but the treatment is not widely available and needs to be obtained under what's called an IND, or an investigational new drug or new device. And then we have multiple people throughout our organization who are partnering with the San Francisco Department of Public Health on the Department of Public Health's efforts, as we have with both COVID and HIV. So long experience with working with our public health partners in San Francisco.
Well, our thanks goes out to those groups as well. Thank you. Thank you so much for that. The next question we have is on symptoms. Are there typical symptoms that one might experience that could be an early indicator that they have the monkeypox virus?
Yeah. So, what was seen previously with monkeypox cases is that most people got a prodrome. So a few days before the rash came out with, what starts usually as bumps, and then you can get what we call vesicles or blisters, and then they can be little pus-filled bumps or pustules. Most people before that, as part of their prodrome, would have fever and also some swollen glands or lymphadenopathy. That in this 2022 outbreak has actually the prodrome, some people have it, but probably less than half of people will have those symptoms before they see the rash. So the first thing that people may notice, is the appearance of the rash or sores. And because of the because of the presumed mode of transmission now, in many people, those sores may first be noticed in the genital area, but definitely not exclusively. Monkeypox sores can actually show up anywhere on the body.
Thank you for that. And we alluded to this earlier, but what are the vaccines and treatments that are currently available for individuals, and who's eligible to receive them?
Yeah, so the vaccine that's being used widely is called the Jynneos vaccine, and it is a live, non-replicating vaccine that's active against both monkeypox and smallpox. I think many people have heard about, the considerations of, how we're going to administer it and at what dose we're going to administer it. So the traditional way of administering it is subcutaneously. So it's not administered, straight into your arm the way most shots do, but it's given under the skin. But the recent data have emerged that you may be able to give 1/5 of the dose and actually give it right very shallowly right into the skin. If people are familiar with getting a tuberculosis test or PPD, that's the intradermal or in the skin method of giving Jynneos. And a number of places with FDA approval are switching over to giving intradermal vaccine because that will stretch the supply more and allow more people to get their first dose of vaccine. And then at this point, some people are eligible for getting a second dose of vaccine because it is a 2-dose series. And so, and there are pluses and minuses to both those things, as one might expect. But areas are looking at changing their way of administering it. So in terms of who is eligible right now, the largest groups are men and trans people who have sex with men, if they've had greater than one partner in the last 14 days, sex workers of any gender or sexual orientation, somebody who has had close contact in the past 14 days with someone with known or suspected monkeypox. There's also eligibility if people have had exposure to folks close contact at a venue where monkeypox is known or suspected to have been transmitted in the last 14 days. And then there are a few clinicians or people who are getting it because of healthcare, but that's actually a small number. So laboratory workers who are performing the direct monkeypox testing in the lab are eligible. And then we do have some clinicians, we think that wearing our personal protective equipment, our PPE, provides excellent protection against monkeypox. And in fact, healthcare workers have not been in the groups described as having monkeypox in this 2022 outbreak based on work-related transmission, because the personal protective equipment does seem to be very effective. But if a clinician examines someone and has skin-to-skin contact with someone, without knowing they had monkeypox and is accidentally not wearing their personal protective equipment, then they may be eligible to get the vaccine as post-exposure prophylaxis.
Great, thank you so much. That was so helpful. And then the last question before we'll take questions from our audience is, what can healthcare advocates, leadership, philanthropists, what can those groups do to manage this new virus and help inform policy and individual actions?
Yeah, it's impressive, that it feels like a new virus. I think that's kind of a commentary on how we approach global health. It's new to us and it's new in this form. I think many of our colleagues in Africa feel rather differently, as I think you were alluding to. But I think that the key things that people who want to help can do, one is just to stay informed through reliable news sources. And, we're very fortunate that we have, lots of places that are really keeping up with the latest developments and, and providing excellent news coverage. So, staying informed. And then I think it's also important to appreciate that the people responding to monkeypox are largely the same people who have been responding for the last 2.5 years to COVID-19. So people are, they're a bit weary, and resources may be limited, because of course COVID's not over. So people are, being pushed in different directions, trying to, provide responses to multiple things at the same time. Our community advocates, I think, have been doing, a really excellent job weighing in with, public health officials and, talking to folks in healthcare regarding their preferences, regarding the acceptabilities of treatment, and vaccination. And so, in advocating for this to be widely available to people who need it, which, I think does help to, push the response along, and has been important in COVID, and certainly has been important in the response to HIV/AIDS. And then, you asked about philanthropists, and certainly those who might be inclined to donate can think about giving support to the places, including San Francisco General, who are diagnosing, vaccinating, and treating people with monkeypox, and doing our best to respond. And of course, research is very active now and ramping up, and that's another place where philanthropy can be directed if people are so inclined.
Thank you. Thank you so much for that. This has all been such great information, and our audience is sending in some questions. So what I'd like to do now is move on to pose some of these questions to you, and see if we can get some answers. So as far as transmitting the virus, should places like gyms, bars, swimming pools, or public transportation be worrisome?
Yeah, so that is a very good question. And, I think it's something that people have thought about a lot, about a variety of different things. I think in gyms, it feels like, best practice that, folks should be wiping down any equipment that they use afterwards. And certainly in areas like public transportation, cleaning protocols have been stepped up, in the COVID era. But what I will say, although monkeypox certainly can theoretically be transferred from surfaces, and pox viruses like monkeypox can survive on surfaces, when we look at the cases that have been diagnosed to date, the overwhelming majority of cases, people have an identified risk factor. And it isn't that they rode public transportation or went to the gym. So while I am a cautious person, I do infection control at our hospital. I always want to make sure that we're providing information to keep people safe. It really does not look like, it looks like it would be very difficult to transmit it in those circumstances, although it may not be impossible. And so that's one of the reasons why I don't think people need to change their behavior. But if somebody wanted to carry a wipe and, wipe down a piece of machinery in a gym that they were going to be touching for a while, I don't think that's an unreasonable thing to do. But I certainly wouldn't advocate for people changing the things they love to do, staying home, that sorts of things, because of monkeypox.
Great. So the next question, I think, harkens back to those of us who were, born pre-1970. And who may have received the smallpox vaccine.
Yeah.
And the question is, to your knowledge, does that having received the smallpox vaccine provide any protection against monkeypox that long ago?
Yeah, fantastic question. And I think the real answer is we don't fully know. Studies looking at monkeypox outbreaks in endemic areas in Africa in the past have suggested that people who had received the smallpox vaccine were less likely to get monkeypox. And there have been estimates of about 85% efficacy in terms of preventing monkeypox in people who have received the smallpox vaccine. Now, those people who were studied had received the vaccine more recently than people in the US will have. So it's not known, if there could be some waning of the immunity. And it's also not known, one of the things that vaccines can sometimes do, even if they don't prevent infection entirely, is they may make disease less severe. So it's possible that somebody who received smallpox vaccine, if they got monkeypox, would have less severe disease. But that is, people are looking at it, but it isn't something that we really know. The other thing that's interesting is, when you look at the ages of people who have monkeypox in the current outbreak, it's mostly in people who are young enough that they may not have received smallpox vaccination. But it's not entirely clear that that's related to not getting the vaccine. It may be related to, kind of behaviors and risk factors that are more common in folks who are a little younger than folks who are a little older. So under active investigation, but it is possible that having received smallpox vaccine might provide protection, and it could be, relatively significant.
Oh, so more to come on that. Well, thank you so much. And thank you to the audience for that question. The next question we have is, does past exposure to chickenpox provide any protection?
Yes, this one I can answer. So the answer to that is no. Chickenpox is caused by the varicella virus. It's not a pox virus, even though it's called pox. So that they're not related, and so sadly, because many people, it's estimated that probably 99% of people born before 1980 have had chickenpox, but that won't provide protection against monkeypox.
Okay, and then I think this is the last question, unless anyone has any more that they want to put forth. And that is, can monkeypox spread asymptomatically?
Yeah, so that is being looked at, and I would say is not entirely known, but so people are doing studies now where they are taking swabs from folks who might have been exposed to see if the virus can be detected. There have been some cases where, the virus can be detected from skin where there aren't any lesions. And we will, I think, need to get more information on this, and also to figure out whether there would be enough virus in somebody who didn't have lesions to transmit it. So, as we learned with COVID, asymptomatic spread was really important. Does not seem to be playing at least a significant role, as we talked about at the beginning with monkeypox to date. But as we learn more, we may learn about, things being possible that, we were not initially appreciating.
Right, that we just, haven't seen.
Yeah.
So I think you addressed this, but maybe the question is posed a little differently here. In terms of the incubation period of time of the virus, and whether or not it's contagious during that time.
Mm-hmm. Yeah, so it does not seem to be contagious during the incubation period before people have symptoms. Now, again, there could be occasional exceptions to this. But in general, when monkeypox has been transmitted, just like with many other diseases, it seems to be transmitted once symptoms develop.
Okay. And then what precautions should the public be taking regardless of whatever risk category they may fall into?
Yeah, so I think we talked about this, a little bit, and, in general, I don't think members of the general public, if they don't fall into, one of the current risk groups, need to be making behavioral changes. We talked about not needing to change, where you shop, where you go, who you visit with, those sorts of things. If people are going to be touching surfaces that they're worried might be contaminated, particularly if they're going to have close or prolonged contact. And I think the gym, is an example of that. If you're going to be holding on to some handles, for a long period of time, might be reasonable to wipe those down first. And I think a lot of people do that anyway, because, we think about transmitting other things besides monkeypox. But given how the epidemiology and how the cases are spreading, I really don't think that members of the public need to be taking special precautions.
Thank you. Thank you. That's reassuring. And that was our last question. So I want to thank everyone for joining us today. Your support of the San Francisco General Hospital Foundation helps us bring important briefings like this session today to our community. And our deepest gratitude to Dr. Lisa Winston. It's been such a pleasure speaking with you today, and thank you.